Imagine bringing home a perfectly healthy newborn baby. Only weeks later, they suddenly stop breathing. Some develop seizures. Others begin bleeding internally. And many parents have no idea what caused it until it's too late. Across the United States, doctors are warning about a disturbing rise in babies dying from a preventable condition linked to one simple decision made at birth: rejecting the vitamin K shot. And according to a major investigation by ProPublica, this trend is getting worse. When babies are born, they naturally have extremely low levels of vitamin K. Vitamin K is essential because it helps blood clot properly. Without it, even small internal bleeding can become catastrophic. That's why for decades, hospitals around the world have routinely given newborns a small vitamin K injection shortly after birth. It's considered one of the most important newborn interventions ever developed. In fact, before the vitamin K shot became standard practice in the 1960s, babies regularly died from unexplained bleeding in the brain and intestines. Once the shot was introduced, those deaths almost disappeared. Doctors considered the issue solved. But now, it's coming back. According to recent data, more than 5% of newborns in the United States did not receive the vitamin K shot in 2024. That's a massive increase compared to just a few years ago. Some hospitals have even reported refusal rates approaching 20%. Why? Much of it is being driven by misinformation online. Social media posts falsely claim the shot is toxic, unnecessary, linked to cancer, or part of big pharma. None of those claims are supported by evidence. Medical organizations around the world, including the World Health Organization and the American Academy of Pediatrics, continue to strongly recommend the shot. But after the pandemic, growing distrust in medicine and vaccines appears to have spilled over into newborn care as well, even though vitamin K is not a vaccine. The most heartbreaking part of this story is what happens next. Some babies appear completely healthy for days, even weeks. Then suddenly, seizures begin, breathing stops, vomiting starts, or bleeding develops inside the brain. Doctors rush to save them with blood transfusions, emergency surgeries, and ventilators. But for many families, it's already too late. Autopsies reviewed in the investigation repeatedly reach the same conclusion: vitamin K deficiency bleeding. According to the CDC, babies who do not receive the vitamin K shot are 81 times more likely to develop dangerous bleeding conditions. And about 1 in 5 babies with severe vitamin K deficiency bleeding will die. Others survive with permanent brain damage. What makes this especially tragic is that many of these deaths were entirely preventable. One inexpensive injection could have stopped it. Doctors say one of the biggest challenges is that modern misinformation spreads faster than medical facts. Parents are being flooded with TikToks, Facebook posts, podcasts, and influencers telling them the shot is dangerous. Some claim delayed cord clamping can replace the vitamin K shot. Research says it cannot. Others claim the shot contains toxins or causes leukemia. That theory was debunked decades ago. Yet these ideas continue circulating online, often reaching vulnerable new parents at exactly the moment they're trying to make the best decisions for their child. And unlike doctors, social media influencers are rarely held accountable when misinformation leads to tragedy. Doctors interviewed in the investigation say they are seeing something they never expected to see again: diseases and complications that modern medicine had nearly eliminated. Some hospitals are now urgently tracking refusal rates internally because no national system exists to properly monitor vitamin K shot refusals. That means the true number of deaths may actually be much higher than reported. One pediatric specialist warned, "If you don't track it, you don't document it." And many doctors fear this may only be the beginning if medical misinformation continues spreading unchecked. This story isn't about politics. It's not about attacking parents. Most families refusing the shot genuinely believe they are protecting their babies. but good intentions do not always protect against bad information. The vitamin K shot has decades of evidence behind it. And according to pediatric experts around the world, it remains one of the safest and most effective ways to prevent catastrophic bleeding in newborns. As misinformation continues to shape healthcare decisions online, doctors warn that preventable tragedies like these may become more common. And for many families, the consequences are irreversible. If you found this video informative, subscribe for more global health and medical news explained clearly and responsibly. And let me know in the comments, should social media platforms do more to stop dangerous medical misinformation?